If you're a physician who's younger and earlier in their career, what are the big takeaways, big lessons that you've arrived at? And of course, they need to read the book, right, to really get to drive the points home. But if you could kind of summarize, I mean, what are the big takeaways for you that you'd want to impart on sort of the next generation of physicians?
My experience is going to be completely different because it was just a different era. Maybe not everything would apply, but like we were talking about before, I would say to people, don't be scared to spread your wings some, do something that maybe is out of your comfort zone. Go to an area of the country that you've wanted to live in, but are a little scared about uprooting. I would say, don't be scared. And if it's somebody who's unattached, and if you want to live in, this is the first city that came out of my head, Omaha, Nebraska. You've always had this desire to live in Omaha, Nebraska. Well, if your spouse wants to go with you, great. Or if you're not attached, sign up for a 6-month contract, go live there, and see if you like it. That really wasn't a thing when I was starting out. And I will also say that, to be easy on yourself in the sense that I think it's important to have high standards for yourself and that you want to do a good job every day. But, you practice medicine long enough and you're going to make mistakes. And so you have to be able to balance those two things. One, your high standard for yourself, but also that you understand that, you can't, I've seen so many patients after 30 years, even if you make that serious mistake 0.001% of the time, that's a lot of people that add up over the years. So you're going to make mistakes, and, you be nice to people and be respectful to them. And, you hope, you don't get dragged into court if something bad happened. But the, you have to understand that eventually it's going to happen. Or uh, Greg Henry talks about this a little bit. There's times where you are going to collide with this patient that comes in the sense that this patient's going to show up and they're going to have the craziest illness that you are not going to diagnose. And I've had a couple of these, and luckily, for most of the time, it worked out. But you're gonna collide with this patient. They're gonna show up when you're on, and they're gonna have something really strange. It's gonna be that really rare thing that's hard to diagnose that you might see twice in a career. And when that happens, your number's up. And if it would just be by grace that that for some reason you figure it out. But I mean, those are going to happen. And if you can hopefully get through it and make the diagnosis. But I think if you have in your head that I'm just going to try and do the best I can for every patient, be respectful, friendly to people, that you'll have a good career. But there are going to be bumps in the road, that's for sure.